Welcome back to the Wellness Effect. Subscribe and hit that notification button so you stay up to date with all of our educational wellness discussions. Today, we're placing the profession of midwifery in the spotlight. With me is Sister Heather Pieterse, who currently practices as an independent midwife. Welcome, Sister Pieterse.
Hi, thank you.
It's a pleasure to have you here, and I'm really looking forward to having this discussion around the profession of midwifery. So how do you support expectant parents in preparing for childbirth?
Good. So I think the main emphasis is on arming women, couples, families with information, so they can make choices and actually have a voice in the process that they're going through. I think the time is long gone where women were dictated to as what they should be doing, how they should be doing it, and just trusting the healthcare professional to get them through it. Um, and that's where midwifery comes in. So it's giving them information before conception, when they're planning pregnancy, discussing what their options are for childbirth, giving them all the various options, not trying to push them into one specific direction, so they can be best armed to make the decisions as to what the best care is for them and their baby. And then onward from there, if they decide they want to do a natural birth with a midwife, then walking with them, walking the path with them, supporting them with their medical care throughout pregnancy, assisting with the birth of their baby, and then our journey continues right up until about 6 weeks after birth as well. So it's a very inclusive process from beginning to end.
Could you explain to us what midwife-led care differs from obstetric care?
Traditionally, midwives were the caregivers. So midwifery is known as the second oldest profession. It's probably the first profession going back in time, because the first woman who gave birth would have had a midwife with her. Um, it's changed, obviously, over thousands of years, where majority of midwives throughout the world are now professional. They have formal training, medical training, where they can deal with emergencies. They can identify risk, screen patients. So yeah, midwives are the caregivers of low-risk, healthy women wanting to have normal birth. And in South Africa, we have the advantage of being able to choose what kind of birth you want, and which is quite rare, because most of the world you don't get to choose. Mostly around the world you will have a vaginal birth, and then a Caesar is as a result of a complication, or if you deemed a high-risk candidate. So midwives look after all the women that are classified as low risk. So our care involves screening of women, giving education to women, as I mentioned previously, screening them to see what candidate are they, have they got any red flags that could cause complications during the pregnancy, giving them good healthcare advice and education, working with them, building up a plan for their pregnancy to help keeping them low risk. For example, exercising, following a healthy diet, looking at lifestyle. All of that comes into it. And we want women to be healthy, because if they're healthy, their chance of having a normal, healthy pregnancy and birth is hugely increased. And then, yeah, midwives, we see them throughout pregnancy. We don't just do the medical care, we're also very involved. I don't like using the word holistic, but we work very holistically. We incorporate everything into our care. So we really get to know the women that choose to come and birth with us. We get to know what their fears are, what triggers them, what their history is, because their history builds into how we can help them through pregnancy and birth. Whenever we see them for their checkups, especially the first consultation, we ask them questions, and you can see they're like, why are you asking me that? Like, how's your family supporting you through coming to a midwife? What does your husband do for a living, or your partner do for a living? There's reasons behind this, because we know that if a woman's partner is maybe traveling away for work a lot, we have a lot of partners that are working in other countries, coming in only every 6 weeks for a week or two. Those women need more support. And that's That's the epitome of midwife-led care, I guess, doing it all, looking after them medically, identifying risk and dealing with it accurately, referring where necessary, and then giving them all that support that they need to help them have a safe pregnancy journey and birth, but also a very satisfying and positive experience.
In what ways would midwife-led care kind of alleviate pressure faced by the current healthcare obstetric system?
Well, that's a very, very good question. And that's one that's on everybody's mind currently. There's a lot of research being done around the world about how midwife led care can actually um, relieve the pressure. So, yeah, women are subjected to a lot of abuse in the system, regardless which direction you're looking at. So in South Africa, we have a system that is overburdened, the state system. It's overburdened. There's not enough staff. There's too many. There's too many patients, not enough staff. The care, while I know the caregivers in the hospitals want to give the care, sometimes they can't. They can't get to it. There's just too much load. They're too overburdened. So those women are often left. They can't get to the care they need. They might live too far away to get to care. They might live too far away to even get in to have antenatal checks to identify high risk. Um, so those women, they're often traumatized by birth or abused in the birth system because they haven't received the care they should have had, or they haven't received the compassion they should have got. Um, and then we have the private system, which is completely the opposite side, where those women also are, to a degree, their rights are also abused to a large degree. While they've got the money, they've got the funding to cover their care, often they're subjected to unnecessary intervention. And that we see with our high Caesar rate. Our country has got a 75% Caesar rate. It's one of the highest Caesar rates in the world. And it's not because South African women can't birth babies. We're not different from any other population of women around the world. And that also is a form of abuse where women aren't listened to, they're not heard, they're not given a choice or a voice. Um, so, yes, midwife led care. There's actually on the 16th of October, the World Health Organization actually launched a paper talking about transitioning to midwife led care around the world, because there's a lot of research going into this. And they say that they reckon, according to their research, 90% of women should be able to be looked after by midwives around the world. Studies have shown that midwifery is not only cost effective, it's also safer, and it leads to far more satisfaction through the whole experience of birth. And honestly, parenting is very difficult. What better way to become a parent than to feel empowered and armed and feel positive about your birth experience, whichever way it goes.
Yeah, so I have a question around South Africa's high cesarean section. You said it's 75% highest in the world. Why do you think that is the case?
That's the golden question. That takes a whole nother session. So there's many reasons. There's fear. Fear would probably sit at the top number one. Um, we live in a culture where a Caesar in South Africa is seen as the norm, and somebody wanting to have a normal vaginal birth is seen as abnormal. Um, and a lot of fear is brought into it. Yeah, that's where midwives come in. We can help alleviate that fear through walking with the woman, providing information, education on what to expect through pregnancy, labor, and birth, including the first 6 weeks after birth. Becoming familiar with that woman, that they trust the person, that they know that person that's working with them is not only professional, educated, but also compassionate and has the time to spend with her. We're available 24/7 for people to phone us within reason, because nobody wants to be phoned at 10 o'clock at night to be
Yeah.
asked something that could have been asked the next day.
And what evidence do we have that midwife-led care can have better outcomes for mothers and babies?
I have loads of evidence just within my practice. I've been practicing as a specialist independent midwife for 27 years, and I have my own statistics to prove it. And then we have statistics in South Africa where a lot of research is being done. One of my colleagues that worked with me for many years actually did her master's on the safety of midwifery-led care in South Africa with very positive outcomes. And then internationally, we have loads of research going on as well, based on this very WHO release. It's not only about safety these days, because they're also looking at the outcomes related to the satisfaction that the woman has as well, because we don't just work with the physical anymore. And the outcome, a woman, even if she's had a very safe birth, if it didn't go the way she wanted it to, and she feels disappointed or let down or disempowered, that is going to impact on her for the rest of her life. Because at the end of the day, birth matters. So yeah, goodbirth.net, they've focused on that. And we've just come through an accreditation process. We were the first birthing center in the world to be accredited with goodbirth.net. And that's based on 3 different standards. One is what women want. The next one is what are the rules and regulations governing it? Are there protocols, procedures? What are the safety nets? And then also, what is midwife-led care?
So could you maybe share with us, you've been in the space for 26 years, could you share some outcomes that you've seen in the patients that you've supported, the positive outcomes you've seen for mothers and babies?
Perfect. First, to just start by saying I only look after women that are low risk and healthy. So obviously my outcomes are going to be better than obstetricians who are looking after high risk, complicated cases. That has to be said. But I have on average every year, it's about 80 to 85% normal birth rate. So we do have complications. It's impossible not to have complications. We have a very high satisfaction rate of women that have given birth with us. Of course, there's 1 or 2 that don't like us. We're never going to have 100% success. But generally, we have a very high satisfaction rate. The moms that birth with us, they have very few complications. The babies go on, and 95% of the moms that we deal with will breastfeed successfully for a long time after birth. The other outcome is the midwife side. It's a highly satisfactory calling. I can't imagine doing something with more satisfaction, actually. Just to launch a mom and a baby, it's incredible. It really is, to see how powerful a woman is when she actually achieves the birth that she's dreamed of. Midwives have definitely had a hard time in the sense that one bad apple actually makes the whole box of apples rotten, which is unfortunate because any other profession, one bad doctor doesn't make all doctors bad. One bad pharmacist doesn't make all pharmacists bad. So yeah, the outcomes depend on each practice, obviously. And yeah, I think the thing is, any woman wanting to look at a midwife for care needs to ask these questions. What are your statistics? What are your safety measures? What is your backup plan if there's a complication? All midwife practices should have an multidisciplinary relationship with hospitals, doctors, dietitians, physiotherapists. We can't work alone, and I think that is really, really important.
Thank you so much for such an engaging and insightful conversation. I think it's going to help a lot of individuals who are trying to make that decision.
It's a pleasure. Thank you for having me.
And thank you for watching. Subscribe to the channel and make sure you hit that notification bell so you can catch every episode of The Wellness Effect. See you next time.
BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.